I know the difference on if I'm like fueling my body properly or I'm not, right? Like my body can feel that. And I think the aging athlete also feels that, right? And they feel how much better they feel when they really take care of their body. They really recover well, they're eating well, they're sleeping well, all those things. So I think that's definitely why we're seeing gymnasts do gymnastics later in life. Is like we found the cheat code, right? And the cheat code is literally just like taking care of your body.
Hi, everyone, and welcome back to Becca Babbles podcast. Today, I have a special guest with me, Dr. Kayla. She is a sports chiropractor, and she was a former competitive gymnast and college cheerleader at the University of Missouri. She got her doctorate of chiropractic and master's of sports science and rehabilitation from Logan University. She's dedicated to her career by helping athletes stay healthy, recover faster, and perform at their best. Dr. Kayla, would you like to say hi to everyone?
Everyone, thanks for having me.
Yeah. So I start off all of my podcasts with the same question just because I feel like we get a better insight into who you are. And that question is, you are walking into a library and then you open up a dictionary and you see your name. How would you be described?
Oh my gosh, that's a great question. I think people mostly describe me as um, talkative, relatable, um, easy to talk to. I like to yap with everybody. Um, yeah,
I
all of
love
those
that.
things.
That's perfect. Yeah. And I could totally see that being you because you're so, when I went to go shadow you, it was like you were very just communicative and like connected to your patients. So I
Yeah,
completely agree.
I love that you noticed that. I feel that way as well. So that's
Hmm.
something that's super important to me, and just creating a connection beyond an injury is super important, and I love that.
Yeah. Speaking of chiropractic and your patients, what inspired you to pursue a career of chiropractic?
So I was a gymnast from a young age. I think I started when I was 4. And so that came with a lot of injuries, doctors, physical therapists, chiropractors. I was in and out of a lot of different facilities. Towards the end of my career, I was injured a lot. And that's when I started to notice there was a hole. My injury that ended my career was a knee injury, and I actually had dislocated my kneecap a couple times. And um, at the time, I didn't really know anything about like conservative treatment of that, right? Like my mom is a respiratory therapist. We grew up going to the ortho, like that's just kind of how it worked. And so um, when I had the knee injury, I went to an ortho and nothing was torn. I had a lot of stretchy ligaments and they just like would stretch and stretch and stretch and not tear. But I never really rehabbed it. And I would just rest and then I would go back and then like I would do it again. And so that's when I was like, wait, like there has to be something missing here, right? Like what is this that I just sit out and then I have to just go back after resting it, but I haven't done anything to prevent it from happening or like get stronger or anything like that. And so that's really where my passion for that started. And I realized like I wanted to go into, actually went to the University of Missouri on the physical therapy track. Um, and mostly because I just like I didn't grow up going to a chiropractor or anything. So I wasn't familiar with that. And I actually was shadowing a couple physical therapists while I was in undergrad. And I knew I wanted to be in sports, and like all of the rotations of shadowing I was doing, it was like in a hospital or like in an outpatient rehab or like all these things where it was just like boring. And I'm like, okay, I don't really know what I'm doing, and I know I don't want to be doing this. And so my parents are like, well, you need to figure it out because you're a junior. Like, what's happening?
Yeah.
Um, so I started shadowing a chiropractor in Columbia, Missouri. And I was like, whoa, like this is really cool. And like you're seeing athletes and you're like making a difference in people's lives and you're spending time with your patients. And wow, like this is something that I would have really benefited from when I was doing that. And I didn't have the opportunity. So, and honestly, I'm sure the opportunity was there. I just didn't know where to find it, which is an issue that we still are running into with a lot of people, right? A lot of people go mainstream, they go to the ortho, they get an x-ray or an MRI, and they either get told to rest or they get thrown into the PT loop and get into like a rehab purgatory and that. And so yeah, that's kind of where I got my start. So I started shadowing that chiropractor in, I guess that would have been like 2015. And I was like, okay, this is what I want to do. And started Logan. I graduated a semester early from Mizzou so that I could start Logan in January of 2017. And the rest is history. And that's how I got here. And I really just always go back to like the access thing, and like people know that orthos exist. People know that you can go to an ortho when you're hurt, because like that's just what we as a society have made really common. They are less likely to know that something like me exists. So my mission is to make myself more available to a larger population.
Yeah, that's great. I'm curious, what was that difference that you saw in physical therapy compared to chiropractic that you were like, this is what I want to do? Because I know
Yeah.
some even have off what's the term, like offices off like a hospital, but like what was
hmm
that for you where you were like, oh no, there's something different to chiropractic?
Yeah. And I think also a lot of it had to do with the specific physical therapist that I was shadowing. They were in the university hospital loop. So of course they're like involved in the hospital in some way. And I just realized like that's not for me and that's not what I wanted to do. I have great friends now who are physical therapists, and they are crushing it. And we are equals and we are doing the same stuff, and they're amazing. So this is like kind of a different storyline, because I think if I would have shadowed somebody like that, I may have gone that way.
Mm.
Probably still practice exactly the way I'm practicing now, right? Which is the cool thing about we have a very good marriage these days of physical therapists and chiropractors, and I have a lot of great friends who are doing amazing things as physical therapists. So I think specific to the physical therapist I was shadowing is like it was your classic like one physical therapist to 5 patients. You don't really have eyes on them the whole time. You have your patients going off of a sheet of paper of like, these are the things you're supposed to be doing. And then like, the person who's low back pain from a car accident is doing the same thing as, 80-year-old with arthritis. I mean, it's just like kind of like, okay, why are they doing the same thing? It
Yeah.
doesn't make any sense. And so that was like the big difference is I saw when I went to the clinic I was at in Columbia, like it was one-on-one. It was, okay, this is where we're at. We're chatting first. We're getting to know the athlete. Do we need to do progressions or regressions of the exercises? Like, what is our audit? How do we know if we're getting better? All those things. And so I just felt like it was a more thorough approach. And the athlete got way more out of it, right? Or the patient or whoever it was is getting that one-on-one time with provider. And I know that there's chiropractors who don't work one-on-one with their clients too, and I think that's totally fine, and they get success as well. But for me, like something that's really important to me is having that like one-on-one time with my athletes. And I think that I personally get better results with that type
Yeah.
of thing.
Yeah, I think who you see doing something really changes like what you decide to do, but then also there's always going to be like, I don't want to say a bad couple, because the the having 5 patients at one time works for some people when it
Sure.
comes to like rehab and stuff like that, and then for other people it doesn't. But you being able to do what you want to do just because you say chiropractic or physical therapist doesn't define like exactly everything that you do. You as an individual practitioner is what defines like what you do. So I like that. Yeah.
Exactly. Yeah.
Yeah. Going
Yeah.
back to your story on like when you were having your knee injury and stuff like that, what was that like for you as an athlete to be experiencing so much pain, but then like I'm assuming just pushing forward?
Yeah. Yeah, and it's interesting that you asked that, because I think back to that a lot, especially when I'm dealing with athletes in here who I know are going through situations that are similar. And so that helps me a lot in like how to deal with it, because I can relate to the feelings that they're feeling. Um, Ultimately, I got into a position where like I was so burnt out, right? Like I was having these knee injuries over and over again, injury after injury, and it was like, okay, this is like just going to be my career from now on, is I'm just going to be injured. So I just like that, and there was other things going on in my life at the time too, but like essentially it was like, okay, like I don't want to do this anymore, you know? And so you just get discouraged because I felt like there was nothing else I could do, right? Like the doctors were saying like surgery wouldn't help. And then like I would go through like some basic rehab and that wouldn't help either. And I would do it again. And so it was just like this never ending loop. And it was really defeating, right? It was like, I want to be doing this, but I cannot do it like this, right? So I think, you know, burnout is a humongous thing, especially in my gymnasts. And what I've realized is burnout happens faster when injury is involved, right? And so if
Mm.
we can take the injury component out of it, those athletes are less likely to have what we call burnout, right? Um, and of course, something I always say is like injuries are going to happen, especially when you're at that level of athletics, right? In any sport, like when you're at a high level, you're playing high levels of sports, you're competitive, like injuries happen, right? Accidents happen and those types of things happen, but also overuse injuries happen, and that's okay. But I think how we treat our language around injury and, you know, just the outcomes and being positive, you know, through the trenches is super, super important. Because I think again, that's like kind of what was missing in my journey of being injured was just like, okay, well, okay, like Kayla's not competing again because she just injured again. You know, I went into my like second season of not being able to compete and it was just like, oh yeah, like Kayla's just gonna sit out because she has been because she's injured. Not like, okay, why, what else can we do? Like she wants to be doing this and she obviously, you know, has something holding her back. How do we get there?
Yeah.
Um, yeah.
I know as I wasn't a gymnast, but I played like multiple sports growing up and like I was definitely competitive in them. Basketball was kind of like where I lived and like being put on the bench was like the worst thing that could possibly happen. Like I didn't care if I was hurt or anything. I just wanted to be out there playing my sport. So I feel for you in the fact that like every time you get injured, it's like, oh, well, you just sit out and rest and recover when like um what are some things that like you wish someone would have told you that you could have been doing in that
Yeah.
moment?
Yeah, I love the way you phrase that too. Something I'm working on myself even in the way I communicate with my athletes is focusing on the things that they can do when
Mhm.
they're injured, right? So if you have somebody, Achilles pain is really, really common in the gymnastics world. So if I have somebody with an Achilles injury and there are things that I don't want them doing, we don't focus on those, right? We make a list of what can we be doing, right? There are a million things that we can be doing. Of course, some of it's going to be rehab for that Achilles specifically, but also there are so many things that they can still be doing in the gym, right? And so I think when you switch your language and into a positive spin on like these are the things you still can be doing, right? Like if somebody has an Achilles injury of some kind, there's no reason that they can't really be doing most of the stuff on bars, right? Of course, we're going to
Mhm.
take landings out. Maybe if they have some type of jumping mount, like we want to take that out, but there's still so much stuff they can be doing. And so there are definitely reasons to make sure they're not doing certain things, but we don't even need to focus on those. Like we make a list. These are the things you can be doing. If you have questions about another skill that's not on this list, ask me. But like you have a million things you can be doing. We can be working on strength in the upper body. We can be working on core stability. We can be working on all of those things. Maybe a lot of gymnasts who come to me with an acute injury also have something that like always hurts, right? Um, Most gymnasts have some type of low back pain or wrist pain, right? So it's like, why don't we jump ahead of that, really work on that while we're also dealing with this injury, so that we come back stronger, right? Um, Instead of saying you can't do this, you can't do that, it sucks, you're sitting out, you're, you know, useless as a human. Like you just really need to focus on like, wow, like you can still do all these things. We, you know, are going to come back on top of this. We're getting on top of other things also while we're doing that. I think just changing the narrative and the language around injuries and focusing on the good is really important.
Yeah, I'm currently in PT2 right now with DMAC and he
Awesome.
very much, yeah, I've been loving that class so much.
I love it.
So he very much stresses the fact of like and even SheMac, she stresses the fact of like we want to keep people active. Like don't tell
Yes.
them what they can't do, tell them what they can do because like the worst thing right now is that we are so inactive that
Hmm.
like being more inactive is going to make everything worse because we need that blood flow. And so, even just with your everyday average person, I think just coming in and saying, like, hey, this is what you can do versus what you can't, it's like way more empowering for the athlete, for just the regular person just trying to go to the gym and get in shape.
100%.
Yeah.
Yeah. And your athlete, it doesn't matter if it's a weekend warrior or an elite gymnast, it doesn't matter where they're at in the spectrum. Like they trust their providers, right? So if you tell them you can't do this, you can't do this, you can't do this, they're going to go tell somebody else that. Well, my doctor told me I can't do that. I can't do that, right? Like that's the thing that sticks with them, right? So like there needs to be less can't language and more like we can do this because we're trying to do this or whatever. I just think it can be really empowering to give them things they can do and work toward, right? Like create those goals and like these are the stepping stones that we need to get to those goals. And sure, like we know as providers, we are avoiding certain things, but we also have them doing a lot of things and that's really empowering for them.
Yeah. And just thinking back to like when I was deep into sports, like I might take a week off or two of when I was supposed to be off. And then once they're like, I slowly feel myself getting better, then I'm going to start doing my own thing because like I want to get back to my sport. Do you find that happening with gymnasts too?
Yes. Yes. I have to like really, and it also depends on like what level of gymnast they are and where they're at. Um, my dancers are the same way. They know one speed and it's like full throttle, right? So as soon as they start to feel good, they're like, oh, I'm good. We're good to go. I'm just gonna like do everything, right? So I have to be really specific. Again, we're not doing can't language, but like we have to be really specific on like numbers of things, right? Like these are the things you can be doing, but also we need to keep our numbers low as we like build up, right? Like they don't really get like the ladder approach on anything. It's just like, oh, I feel good. Like we're gonna go, right? And then of course we know 9 times out of 10 they finish that maybe either that day or the next day they're like, whoa, like okay, it hurts again or whatever, it didn't go perfectly. Um, yeah, so I think just the more specific you can be on that like return to play, return to sport protocol with them is super important.
Yeah. And I feel like even someone who's not even in like chiropractic, they can like the mental voice that you put in your own head, like that's important of showing yourself like what you can and cannot do, or not saying
Yeah,
what you can't do, but what you can do.
100%.
Yeah. So
Super
speaking of
important.
chiropractic, what specifically have you found that chiropractic can help athletes improve when it comes to performance and recovery?
Okay. I mean, I feel like that question encompasses like my entire practice.
Yeah.
Um, yeah, so I think my job and my passion is truly bridging that gap, right? So, in these athletes who come to me with acute injuries, um, so much of the time they get stuck in the rehab purgatory we're talking about all the time, right? That like it kind of feels better, but like when I do the thing that hurt it in the first place, it still hurts. Like they just live in this like land of injury, right? And so truly being the gap that's there, right? Like from our, okay, we're injured, we feel better, and then they just like go, right? But there's like that humongous spectrum in between there that's like our rehab, our strength conditioning, like our return to play that is missing in so many routines, right? And so being that bridge is like what I aim to do and be for the rest of my career, right? Like I want to be that person that like I will be with the athlete from the injury all the way to the time that they're like ready to go. Does that mean they're going to be in my office that whole time? No, like that's where like they need to be with a strength and conditioning coach, like maybe nutrition is a piece of it. Like we have to get them across that bridge. We're skipping it so much of the time, right? And then that's when we end up in this like injury or rehab purgatory where it's just like we're going in circles with injury, we're going in circles, not making any progress, or maybe we make some progress and then it's like the whole 2 steps forward or 3 steps forward, 2 steps back, whatever. And instead of like really addressing the issue and following it all the way through to that performance piece, we're skipping it all the time, right?
Yeah.
So yeah, I think being that piece for my athletes is like my number one goal. And I'm not really even sure if I answered your question.
No, that was great.
But yes, yeah.
Yeah. How would you describe that like difference between like just going from like rehab to like to just going back to like performing to that like in between phase? How could someone identify if they're getting that in between phase?
Yeah, so what I see most of the time, and to be honest, like there are times when they're they're getting maybe a mix, right? Like they are doing some strength and conditioning, they are doing some rehab, but they're like going back too fast, right? And I will say I see that a lot. And so that's when like that's where it's my place to make sure like we're managing that well. But the biggest thing that you'll see is when somebody just forgets the two, right? They maybe came into my office for 2 times and we did some type of corrective exercise for those 2 times, didn't, increase load. We didn't do any of that. But then all of a sudden they're like back to vaulting. Like we skipped so many pieces there, right? Like when we're talking about athletes, sorry, hey, it's right there. When we're talking about athletes, especially gymnasts, like when they're tumbling, they're coming down at up to 17 times their body weight, right? If we just go from like rest, a little bit of corrective exercise straight into that, like your body's not prepared for that at all, right? And a lot of times we'll re-injure the tissue that was injured or injure something else in the process, right? Yeah, so I think that recurring injury is a sign that we're like skipping that. That would be like the biggest sign. And also overuse injury is a sign that we're skipping something, right? Overuse injuries happen, right? But if like you came to see me for an overuse injury and then you like feel better, but then you come back to me with the same issue, like we missed something, right? There should be, sure, things are going to pop up, but they should then be able to manage it themselves, right? That's my goal, is to be like, okay, cool. Like we got you to this point. Now we know all of the tools. We have every provider in our toolbox. I have these skills in their toolbox that they can now manage the injury. Of course, if they need guidance, I'm here, but like, I don't want to see them in my office every week, right? Like that means I'm doing something wrong. Like unless they just like really want to come hang out with me, like we don't need to be doing that, right? And so I think when we see an athlete from acute injury and then, all the way through the loading period and they're ready to go, you're not going to see that person for a while, right? For that thing, right? I'm not saying that other injury can't happen, but like you're going to see like a true resolve. That's when we know that the bridge is happening.
Yeah, I like that. Especially the point where you're saying if you're coming back with an overuse injury, like that's kind of a key sign that you didn't actually fix the problem in the first place.
Correct.
Yeah.
Yeah.
What are some common injuries that you typically see in your gymnasts?
Yeah, I think the most common injury that we see is probably low back pain. And then trickle in literally everything else, but wrist, Achilles, elbow, shoulder, knees. That's probably our most common.
So just like all the things.
So literally everything.
Yeah.
But yeah, I mean, low back pain is going to be the most common, and that's for a number of reasons. From a core stability perspective, they're doing zero, right? Maybe zero is a bad word. They're trying, just a lot of times missing the mark on the whole idea of core stability. And that's the thing that's a hard conversation with the gymnast sometimes, is like they come to you and they are so strong, right? Like they are strong athletes. Ask them to do anything gymnastics related and they're going to lights out, just like figure it out, right? But what we miss is the core stability component of that. They have no idea how to stabilize through their core, which then turns into a number of issues, right? The other thing is gymnastics is such a repetitive sport, and a lot of gymnastics is in the same position, right? So they're spending so much of their time in that back extended position. Obviously why we have a lot of low back pain come up. But the biggest thing that I see is like, okay, yeah, their low back is hurting, but it's probably their hips or their shoulders that really aren't moving well. So then we're just like folding through the low back every time when we should be like extending through the hip or flexing through the shoulder or stabilizing through the core. Like it's, of course, like the symptoms come through the low back and like the pain is in the low back, but like 9 times out of 10, it didn't start at the low back, right? It started because, okay, you can't flex your shoulder at all and you have to go into low back extension every time you go into shoulder flexion. Repetitively, you're doing that, I mean, a million times a day, right? So speaking of overuse, that. I mean, it's hard to avoid a lot of the overuse injuries that come with gymnastics, and that's seriously like what I try to drive day in, day out, is just like showing them, like if I have somebody with low back pain, like I need to show them like, okay, you are telling me that you're in shoulder flexion, but like, look at this, right? Like, look at how your low back is like doing all this movement for you, and like how much we could protect the low back if we just got the shoulder moving the way it should, right?
Mm-hmm.
Um, yeah, again, I forgot the question because I'm just yapping away, but I hope I
No,
answered it.
yeah, it's all great. I'm curious, could you go a little bit into like the difference between like flexibility and like that mobility?
Yeah,
Because I feel like a lot of people are probably thinking right now, like, um, gymnasts are super flexible. They can
yeah,
totally go, they should be able to go into like shoulder flexion. Why are they getting this back pain if like they can do all these like bendy things?
yeah. Yeah, that's a pretty multifaceted question as well. So just stop me when I start to get too long-winded, but both are important, right? In a gymnast, you need flexibility, but you also need mobility, right? The flexibility is required, right? Those are requirements. They are judging your leaps off of your flexibility. They're judging your everything is judged off of like your flexibility. But in order to do those things for a very long time and to protect the joints, you have to have the mobility to go along with it, right? So in let's just use the shoulder as an example again. Um, just in general in anything, flexibility is going to be like with momentum, right? Like it's a stretching of the muscle around a joint with momentum, but mobility is taking the momentum out of it. So like, what does your shoulder flexion look like at rest? How, can you go into, like, my favorite position to put them in is like a child's pose because I'm in like a lumbar locked position. And then can you go hands in front of you, lift your arms up? Half of them can't do that, right? But they're swinging around the bars in a very shoulder flexed position, um, over and over again. So we don't have motor control over that, right? Like, that's like a completely un we're not using any muscular strength through the joint in those positions. It's just momentum happening, right? So that's what I like to focus on a lot. It's like, okay, we need to increase our shoulder mobility at rest and at our end range so that when they are forced through their end range, we're less likely to see those injuries.
Yeah. Because these gymnasts are going like they want to perform, so they're going to put themselves, their body in positions to get there, but the body
Correct.
can only do so much.
Yes.
Yeah.
Yes. And the body is an amazing compensator, right? So there are going to be times when, like, the body just figures it out, right? And so that's when you start to see the overuse injury stuff, is because, okay, cool, you don't have the shoulder flexion that you need in that skill, but your body's doing it anyway. So then, it either shows up in the shoulder or it shows up in the low back or whatever it might be. But when we like really take it back and take the layers off, it's like, okay, the shoulder flexion is what we need to be fixing, right?
Hmm. You talked a little bit about just like core activation and that how some of these athletes don't seem to have very much of it, which doesn't make much sense as far as like because they are so strong. What do you mean by the core activation?
Yeah, I think that's a great point, because that's the sell, right? Because they're like, I have a six pack. Like, what do you mean my core isn't stable? And I have to like peel back the layers again and be like, that's not the same thing, right? So really what I'm talking about there is like, they don't understand what the function of the core should be, and then how to utilize that core function in their gymnastics, right? The other thing that they think is wildly boring and dumb is like just putting them in a dead bug. They're like, this is so easy, right? So what I like to do, of course, we need to like start at a dead bug. Do we have proper pressure happening? Are we sending a breath low? Are we sending it? All those things are super important. But what's more important is how do they translate that into their actual gymnastics? That's when they start to care. And when they see change, when they're like, whoa, when I do that small expansion of my belly in that skill, I feel better, or like my back doesn't hurt after it, or when it's just like when they start to see, when I use my core the way it should be used, when I'm able to create that relationship of my core all around, right? When a gymnast thinks of core, they think of their six pack, right? Like, that's not what I want them thinking of. Like, I need you, like, diaphragm, pelvic floor, low back, like everything needs to be involved. And so like I stress that a lot. Like, I don't care, like, six pack abs, awesome, love it, but don't care, right? Like, we care how is your core functioning, and how can we maximize your performance because of that, right? Um, so I think what's important there is just like explaining to them the relationship that the core has with the rest of the body, right? We know that proximal stability equals system mobility, but how do we present that to them in a way that, one, they understand, but two, like, they want to work toward, right?
Yeah.
Um, So for them, it's really just putting them in gymnastics positions, which you'll see if you come in my office and I have a gymnast, like we are getting in those positions. Like you can't not do that because they're like laying on the ground in a dead bug is super boring. And I don't understand how that translates into my gymnastics, right? We might do that, sure. But like we're also going to be doing sports specific like movements and things like that.
Yeah, you always got to meet the patient where they're at.
Yeah,
Yeah.
100%.
With the core activation, I know that like you have to create some sort of like expansion. So a lot of people think of like belly breathing, even though
Hmm.
it should be this whole like 360 thing. And
Hmm.
even with that, some people have some like issues when it comes to just actually creating that expansion. And I know for gymnasts, like aesthetics is a big pressure when
Hmm.
it comes to performing. How do you like make sure that your athletes are creating that healthy relationship with their body image when it comes to creating that expansion?
Yeah. I feel like there was a couple questions in there that I'm gonna, again, if I like completely tangent, just let me know. Um, to plug Aaron McGuire, I use a Core 360 on almost all my gymnasts. That just like helps them to feel what they're supposed to be doing. But it is breaking old habits of like sucking in your stomach, right? As a gymnast in the late 90s, early 2000s, we suck in our stomach like it was our job, right? Um, So from an aesthetics perspective, it is a harder sell. But I will say, when you look at gymnasts like Simone Biles, Jordan Childs, all of these people who are monsters in gymnastics, if you Brett Winchester always uses the example, like if you look at Tiger Woods when he hits the ball, if you look at Wayne Gretzky when he hits the puck, like at the moment of impact on these superior athletes, they're not sucking in their stomach, right? Like they are like they just have this massive amount of pressure in there, and that's why they're able to do these skills over and over and over again, right? And I'll always tell them that. Like, look at this photo of Simone Biles. There's no way she's sucking in her stomach, right? Um, but I think it's a hard conversation, and that's why I was just saying that this is like multifaceted because for me, I'm coming at it from a completely functional perspective, right? Like functionally, we are not meant to suck our bellies in, right? Aesthetically, that's a really hard sell for them, right? They are one in a leotard all day, every day of their life, right? Who wants to walk around with their belly expanded in a leotard? I mean, not me. So I get it, right? Um, so that's a really it's a hard conversation, and I honestly, it depends athlete to athlete. I have athletes who I know struggle with their body image and struggle with their relationship with food and all of those things. My conversation is going to look differently with them than it does with somebody who may not struggle with that, or at least not outwardly struggle with that. Of course, I can't take everything out of everyone, but I think I'm pretty good at it, figuring out if we're struggling with something like that, which is super common in that world. But I think, again, it's just the language that you use around it. Um, I would never say like make yourself look fat or like anything like that. So we completely leave it to function, right? Like this is the way that the core is supposed to function, and this is what it looks like when it does that. But again, if we're just completely missing the mark there because they have other stuff, that's when I would probably refer out to a friend who, I have a friend who I send all of my nutrition stuff to when it's completely out of my scope. Um, I can pick up some things and help out with some things in regards to nutrition and stuff. But especially with these really high level athletes, I have a person for that. And I like to send them to those people. They're the professionals and they will get the work and the help that they need. Um, and I think it's an important thing to recognize in my gymnasts, because if they're struggling with something like that, how is their body supposed to recover the way that we want it to recover if we're not fueling it properly, right?
Mhm.
So I think it's important to know any of that is really important. In my intake forms for my gymnast, two of my questions are, one of them is there a history of eating disorder at all? And two is, have we started our menstrual cycle? Um, I think to just go a little bit into that whole side of things, um, knowing if a gymnast who is 15, 14, 15, 16, 17, 18. I mean, I've had some gymnasts who are, 18 years old who haven't started their period yet. That's like a vital, right? That's just like their blood pressure and their pulse. Like that is a pulse check on them, right? And so if you do have somebody coming in and they're just like overuse injury after overuse injury, and we also look at that and they haven't started their period yet, we know that there is something that I'm not going to be able to fix, right? With just movement, with just load, right? That's something that needs to be addressed elsewhere, right? Whether it's looking at food or we need to look at hormones or whatever, there's just a missing piece of that puzzle there. And I might make it feel better for a little bit, but like long-term wise, that's probably going to continue to happen or just pop up elsewhere, right? So I think that's really, really important. Working with any type of like high level competitive female, that's a vital sign, right? That tells us a lot about the body, right? That's like a function of health that we need to know about, and it tells us a ton.
Yeah, if you were talking to an athlete, like let's say you have an athlete in front of you and she like hasn't started her cycle and you're trying to stress the importance of like why we need that, what does that conversation look like?
Yeah, it's I've had that conversation a couple times. A lot of times mom or dad is in the room too, um, which can be to your benefit or to your detriment, depending on what's kind of going on. Most gymnasts are dying to tell somebody that they feel comfortable with something like that is going on, right? Like I'm having a bad relationship with food, I'm falling into maybe some bad habits that I used to have, those types of things. Um, and so what I was saying, like with the parent, is sometimes they don't want their parents to know they're struggling with that, right? So like it'll be sort of a weird conversation. Um, and then the parents will approach you later and be like, what's going on with this, whatever. Um, I think the best thing that I can do as a provider in that situation is just create an environment that they feel comfortable talking, right? Um, the gymnastics world in a lot of ways it's moving forward, but there are a lot of scary things still happening and not so great things that still go on, and it's so competitive and you have to look a certain way and all that stuff, right? And so the pressures are a lot. So just to create an open environment. And if let's just say I do recognize some type of disordered eating, I will bring it up and I will say that like I have resources for you if that's something that you're interested in. And then I usually will talk to the parent and just see like, hey, what do you think about like are you getting a good read on what they're eating at home? Are you, providing resources for them to eat, healthy foods, whatever? Do they need to talk to somebody basically? Because I can get you that, right? But it boils down to it has to be the gymnast wanting that conversation to happen, right? So if I've had somebody in the past dealing with an eating disorder, and it's almost just like this person was pretty resistant to getting any sort of health treatment, whatever. You just kind of like have to pry in a nice way, right? Like you have to look at it like, hello, this is super, super important and can help. But they're also really good at hiding that. So if you're not creating this like environment where they feel comfortable telling you what's going on, that's going to be a hard situation to sort of grasp. But providing resources to them is really, really important. But I would say above all is just providing like an environment where they feel comfortable coming to you with something like that. Because that really is super, super important, especially in that demographic of females and males. Same thing, right? There's same situation, you're in a leotard and all that stuff. But super important conversations to have, and just talk about it like it's a walk in the park, right? That's the other thing is like the language, again, the language you use around things like that, you have to, for some reason, and I remember this, like when I was a gymnast, we did not want to talk about periods. I don't know what it was, but like that was just like hush hush, nobody talked about it. It's still that way. Like it's like, why? Like you're in the gym all day, every day with like 100 other females, and it's weird and like faux pas to talk about a period, right? I'm like, this shouldn't be that way, right? And so I try to be really cognizant about the language I use and talk about a period or food like it's just, chapstick. Like it's not like a weird thing to talk about. It's important. And it's like the mental health conversation, right? Like the more we're talking about it, the more we are bringing it up, the more normal we make those things feel, the easier it's going to be for those athletes to bring it up to you, and not make it an uncomfortable situation, right?
Yeah, I know for some people, especially when I was personal training, there's this one lady in particular that I remember, and like it was specifically more towards like food or feeling like comfortable talking about those things, just so that she could like um, get back to cycling again. And it was just bringing up the fact of like this fuel or this food is going to fuel you, and like once you get that cycle back, like you are going to like perform better than what you think you are now. Because I think a lot of the
Yeah.
times, or at least when I was growing up, it was like, oh, you get your period and like you're dead to the world that week. And it's like it shouldn't be that way.
No.
But it may start out that way when you get it back. But once things start to balance out, that's where you'll actually start working with your body and you'll start performing better than what you are right now.
Correct. Which always happens, right? It's like
Hmm.
you have somebody who's struggling with something like that. They work with somebody and have really like tackled their food and are fueling their body well and eating the right things before practice and, just like crushing it. And they're like, whoa, I feel better. I'm not injured. I look better. Like all these things where like instead of looking at it, from the angle of like, I mean, it's a normal thing to unfortunately be in that world and have like a bad relationship with food, because of the pressures and the look and all of that stuff. But um, I think just creating a normal narrative around it and promoting healthy habits and what can happen if you are fueling your body right is really important. Um, yes, and then of course seeing success in that journey for them is really important.
And just like being by their side and like contributing to like congratulating them on all the things that they're doing, I think is the
Yes,
most important. Yeah, for sure.
yeah, for sure.
For those gymnasts that do have their cycle, do you find that like training needs to change for them in certain phases, or does it stay pretty consistent?
That's a great question. So the thing is, the training will not change, right? But what you can change is your fuel, right?
Mm,
Like your fuel is the thing like that needs to stay up to par with like the things that are going on with your body, right? Um, those two go hand in hand. I'm like if you have a healthy cycle happening, we most likely are eating well as
mhm,
well, if that makes sense, right? So just making sure that those two things are going together, we're feeling good, we're fueling properly, we're not injured, all of those things. But we do see, honestly, is like once an athlete consistently has their cycle, a lot of like the growing pains, for lack of a better word, kind of go away, right? Like a lot
mhm,
of gymnasts who maybe struggled with a lot of like Sever's pain or gymnast wrist, all of those things, like, okay, our growth plates are closing now, right? Like we've hit puberty, all these things. And you'll notice that like, I mean, NCAA gymnastics is an amazing example of this. Um, these gymnasts are peaking way later, right? When I was a gymnast, like you had your peak at like 15, right? And then it was like, okay, like you're injured and whatever. And gymnasts were going to the Olympics at 16, which they still are, which is amazing. But you're also seeing the aging gymnast, right? Like Simone Biles was 26 at the last Olympics. I mean, Chelsea Memel is blowing everybody out of the water. She was like 33 when she competed last. So we're seeing this shift of like, wait, we can use our womanhood to our advantage, right? Like we are strong and healthy and taking care of our bodies, and like we can use that to our advantage.
mhm. Do you think recovery plays the biggest role in that aging athlete?
Yes. I think recovery is a big thing. One, they're like taking, like if you look at Simone Biles' schedule, she's not in the gym 100 hours a week, right? Like she's really, really particular about her training schedule and emphasizing recovery, right? And I'm not talking about recovery going to see somebody. I'm talking about like days of rest and strength and conditioning and rehab, and those types of things are important. And she makes them a priority, right? Sleep. Sleep is like humongous. I always tell every single athlete I see, like sleep and hydration and nutrition are three things that I can't change for you, right? And they are going to make a massive impact on your sport, whatever it might be. And nobody else can really change those things but you. So I think with the aging athlete, like they get that, right? Like for me, if I just were to like, of course, I'm not an elite athlete of any sort anymore. But like the smallest things, like even a run for me or like a heavy workout, like I know the difference on if I'm like fueling my body properly or I'm not, right? Like my body can feel that. And I think the aging athlete also feels that, right? And they
Mhm.
feel how much better they feel when they really take care of their body. They really recover well, they're eating well, they're sleeping well, all those things. Whereas when you're just like 12, you can do anything, right? Like you're running through walls and you don't even have to recover after that, right? So I think that's definitely why we're seeing gymnasts do gymnastics later in life. Is like we found the cheat code, right? And the cheat code is literally just like taking care of your body.
Mhm. And I feel like it's so hard for like any athlete in general just to like pull back because for so long, I even know for myself, it was like told to like, you need to do more. Like,
Yeah,
if you want to get better, you got to do more. And then you get like that antsy feeling of like, well, I need to do more when actually it's like, no, I need to do less to
yeah,
perform. Like, it's almost like you're sprinting when you're performing, and to compensate for that sprinting, you need to like have the adequate rest to compensate for the sprinting.
yes, yes. And I am a huge proponent of limiting numbers for gymnasts when they're recovering from injury, right? So what I mean by
Mhm.
that is like a lot of coaches will give them like a set number of routines or a set number of series or whatever, which is important because again, like practice makes perfect, but I'm here to say that like perfect practice makes perfect, and you can't have perfect practice without being healthy, right? And so I'm a huge proponent of like, okay, you usually do 10 series. Let's, wherever we are in our recovery, we're going to cut it down, right? Maybe we only start with three, right? Because what you'll see is like once they like spell out for you how much they're doing, it's like, well, no shit, you're hurting, right? Like you're
Yeah.
just doing so much. Sorry for cussing, but like they're doing so much. And so it's good for them too, for that exercise to be like, look how much you're doing. And we could take one tiny thing away here and like you could still be doing a lot, but this is better for your body, like for recovery purposes, right?
Mhm.
Um, yeah.
Yeah. For that athlete that's like struggling to change that mindset, what would you tell them, or how would you phrase it to be like this like low back pain, for instance, let's say that you're experiencing is due to like you thinking you need to have this like push through mindset?
hmm Yeah, I think it's again, it's going to vary athlete to athlete and what it boils down to, right? Is it, do they think they need to be doing that much because they're trying to impress their coach, or are they trying to earn a spot in a lineup, or are they like, why are they pushing themselves this hard, right? Um, are they not getting a skill and they think that like repetitively doing something is going to help them get the skill? Well, like maybe is
Mhm.
there something else we could do, that wouldn't require so many numbers to get to that skill? Maybe that's something we need to talk about. Um, yeah, and I think, coaches are doing an amazing job of like two-a-days. There's still a thing to a degree, but like two-a-days used to be like something that every gymnast was doing, right? Like you were going and training in the morning, you were probably homeschooled, you're doing school like in your little break, and then you also train in the afternoons, right? Coaches are finding that like that we don't need to do that, right? What's more important is when we have one practice a day, then they can recover, right? They have like such a longer period of recovery than when we were doing the two practices a day. Um, and like less injuries are happening because they're recovering. And so having little changes like that, it's proof also to the gymnast to be like, less is sometimes more, right? Like more is not always better. It is, I
Mhm.
think, the conversation that needs to be had over and over again. And that's why I mentioned like the perfect practice makes perfect, because if we're just like throwing our bodies around for the hell of it, like it's not good. Like there's probably a pretty good chance you're going to get injured, right? And especially if you're already injured and you already are hurting, and then you're just like doing things to do the numbers, like we're not doing anything good here, right? And so that's when I'm a huge proponent of like three great series or three great routines are far better than like 10 messy, hurting, not good routines, right?
Mhm.
For confidence reasons and for body reasons and recovery reasons and all the things. I mean, there's a million different reasons that I would argue that. From a consistency standpoint, I understand like you have to be getting the numbers, but I think those need to be good numbers, right? If again, if we're just filling our body around just to get the number in, it's like you're hurting yourself more than helping.
Yeah. And even just thinking of like most athletes or most gymnasts are like pretty young, and like you're just like the programming that you're putting in your brain of like, this is the pattern that I need to do. You want to make sure that pattern that you're doing is like the right pattern, and then not having to like later figure out how to reprogram the pattern that you put in that wasn't the right pattern.
Correct.
Yeah.
Yeah. Which I think is a lot of gymnasts go through that, right? And also you go through something when your body does change. Because again, like I said, when you're 12, you can just like run through a wall and everything is fine. Like you reach a point in your gymnastics where you can just like no longer do that anymore, right? You're growing and you're hitting puberty and all these things, and your body just isn't as responsive as it once was. So if we're creating those habits younger, those good habits then carry into older gymnastics, right?
Yeah, for sure. We want to have that aging athlete as much as possible.
Yeah.
Yeah.
Yes, we do.
When it comes to like creating that plan for the gymnast, I know it's not just the chiropractor that's doing it. So how do you collaborate with like coaches and trainers and other medical professionals to create that plan for the gymnast?
Yeah, I think creating a team is what drives the most success. Like some of my most successful stories of injury to like performance is because of the team that the gymnasts had around them. So I have a number of orthos that I work with that I love, but sometimes it might be an ortho that I'm working with that I don't know, but I will always make contact with them. I want to have like an open line of communication to make sure like we're on the same page on everything, right? So I think like the perfect marriage is the athlete obviously is at the top, but then we have me, we have the parent, and we also have an ortho, right? That like magic circle is going to move mountains if everybody in there is talking, right? Add the coach into there and it's even more magic, right?
Mm.
Having access to a coach is amazing because then I could see the athlete and be like, hey, this is what I saw today. This is what she's complaining of. These are the things that I want her doing. Like, let's limit her numbers to whatever. And then the coach can also flip back at me and be like, hey, just make sure that you ask so and so about this because she was complaining about it today at the gym. So just having this like open line of communication is super, super helpful. And I think just I don't have a magic answer of like how do you make those relationships except for like make those relationships. And some coaches will be more receptive than other coaches. That's okay. But just having that line of communication, I think is really, really important.
Yeah. I'm curious, what's the most rewarding part about working with gymnasts for you?
Seeing them perform and just crush it. And I have a lot of gymnasts who have gone NCAA and now they're crushing it in that, which is amazing. I'm actually going to see one of my gymnasts who competes for Arizona. I'm going tonight. She's competing in Fort Worth, so that's really exciting.
That's awesome.
And honestly, it's like, of course, that's big stuff, but the little things like, okay, it really is. It feels like the end of the world when they get injured, and then it's like, okay, now like I'm going to help you get back to where you want to be. And so just like being by their side through that whole process is super rewarding. Just to see the benefits on the other end, even when sometimes I'm like, okay, I'm getting gray hairs from you guys because what is happening? But it is really super rewarding, and I just love to see them compete and succeed and all the things.
Yeah, that's great. I have one last question
Yeah.
before we get to like all of your information so people can find you, and that is, what would you tell your younger self?
Oh boy. I would tell her that everything is going to be okay. I would say, especially when I was in that competitive gymnastics space, a lot of days felt like it was going to be the end of the world and like I was a failure because I quit gymnastics or this and that. And it's like, no, I think the biggest thing is that like I would tell my younger self that I'm going to use that, stress and everything that I went through in a passion in my adult life. And so that's truly why I love this so much is because like younger Kayla would have loved to have, gone to somebody like me, right? And so I think just saying like everything's going to be okay and you're going to figure it out and now you're going to help those in need.
I love that. That's amazing. Where can people find you?
So my Instagram is at Dr. Kayla Keck and my website is p10rp.com. And I also have a P10RP Instagram. I think that's all the places.
Perfect. All right. That will be in the description. So if anyone wants to click on those, they can definitely find you there. Thank you so
Awesome.
much, Dr. Kayla, for being on the
Yeah,
podcast.
of course. Thanks for having me.
Yeah. Thank you so much for listening to this episode of Becca Babbles podcast. If you enjoyed this episode, the best thing that you can do is leave a 5-star rating and review on Apple Podcast, Spotify, or any other listening platform of your choosing. If you want to learn more about me, you can do that by following me on Instagram at Becca and Wellness, or by checking out my blog, freebies, offers, and newsletter on my website at beccaandwellness.com. If you want to share the love of the podcast, you can do that by taking a screenshot and sharing it on social media and tagging me and the podcast at Becca and Wellness and using the hashtag Becca Babbles Podcast. I hope you have a great rest of your day, and I can't wait to babble with you next time.